Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Important tumor and its classification. So first is we are looking at the Bloom-Richardson. Bloom-Richardson is for the carcinoma of the breast. The carcinoma of the breast. Next is the Butchert staging. Butchert staging is for the mesothelioma. Then we look at the Chang staging. The Chang staging is for the medulloblastoma. Chang. Now we look at the Duke. The Duke, it stands for the colorectal carcinoma. Colorectal carcinoma is nothing but the Duke. Now we are looking at the Gleason. So Gleason is for the prostate. Then the Jackson. Jackson is for the carcinoma of the penis. Carcinoma of the penis is Jackson. Then the Masoka. The Masoka staging is for the thymoma. And the Noguchi. Noguchi is for the adenocarcinoma colon. Adenocarcinoma of the colon. So Masoka is for the thymoma and Noguchi is for the adenocarcinoma. Now we are seeing a Nevin. Nevin staging is for the carcinoma of the gallbladder. Carcinoma of the gallbladder. Now let's look at the Robson staging. So in terms of the Robson staging, it involves the renal cell carcinoma, or we can write it as RCC. Then is the Rees or Ellsworth. The Rees or Ellsworth classification. And the SN prognostic index. So they are nothing but the retinoblastoma. So let's repeat, it's the Rees and Ellsworth classification as well as the Esson's prognostic index. Robson was for the renal cell carcinoma. Then the Shimda index. The Shimda index is for the neuroblastoma. And when you're looking at the Sullivan modification of the McFarlane system, the Sullivan modification, and this is of the McFarlane system. So this is nothing but for the adrenocortical. This is for the adrenocortical carcinoma. To learn and grow daily like this, please do subscribe.